Hello, Mrs. James. How are you doing? My name's Fernando. I'm going to be your nurse. Can you confirm your name and date of birth for me, please? LeBronna James, December 30th, 1984. Wonderful. And are you allergic to anything like chlorhexidine or any tape allergies I need to know of? No? All right. So I'm here today because I'm going to insert a Foley catheter in you. Have you ever had that done before? You have. Okay, well, let me explain the procedure to you anyways. So the reason why you're getting a Foley catheter is because you're retaining some urine in your bladder. So the catheter is going to go inside your bladder and it's going to make it a little easier to get rid of that urine that's being retained in there. So I'm going to start off by cleaning the labia, and I'm going to insert the catheter through the urethra, and it's going to go inside the bladder. Once it's inside the bladder, there's going to be this balloon at the tip of the catheter that I'm going to inflate with saline. This is going to help the catheter stay in place. It shouldn't be painful, might be a little uncomfortable or awkward, but if you feel any pain during the procedure, please let me know, okay? And then afterwards, I'm going to collect a urine sample, send it to the lab, and they'll check it for any infection or anything else that they're looking for. And then I'm also going to attach the tubing to your upper thigh to what's called a stat lock. This is to make sure that it doesn't get stuck on anything and to make sure it stays in place, okay? Do you have any questions or concerns for me? No? All right. And are you in any pain or discomfort right now? No? All right, let's go ahead and get started. I'm just going to get my supplies together, okay? Just hang tight. So I'm going to do 20 seconds of hand hygiene. All right. Go ahead and put those on. I'm going to clean the table for 30 seconds and let it dry for 2 minutes. All right. I'm going to go ahead and close the curtains for patient privacy. And I'm going to do 20 seconds of hand hygiene. All right, Mrs. James, we're going to start cleaning the labia, okay? I'm going to place the patient in supine position. Go ahead and put the blanket down. And then there's a chucks pad between the legs. Can I lift up your gown? Yes, thank you. I'm going to place your legs in a frog-like position. Let me know if you feel any pain, okay? Any pain? No? Wonderful. Okay, how about here? Any pain? No? All right, wonderful. Okay. So I'm going to do 20 seconds hand hygiene. It's going to be a little cold. Okay, Mrs. James, I apologize. One side. On the other side. And then clean down the middle. Alright. Just going to put this down for the meantime, okay? Put the wipes back. I'm going to do 20 seconds of hand hygiene. I'm going to put on a clean pair of gloves. Tail's been drying for 2 minutes, so it should be okay to put my supplies down. So I have my 10 milliliter syringe right there. I have my stat lock, and I have my chlorhexidine wipe. Then I have my catheter kit, my Foley catheter kit, which I'm going to take out. I'm going to open this away from me. I'm going to grab the sterile drape, making sure to only touch the outer border. Making sure the glossy side is down. All right. Continue putting the supplies in. All right. gloves. All right. And I'm gonna go ahead and lift this, okay? Alrighty. I'm gonna take off my gloves. I'm gonna do 20 seconds of hand hygiene. Okay, everything's good. Go ahead and put this down. Get my supplies together. Go ahead and drop this over here. Go ahead and put this here. Take this out. Connect this. All right, Mrs. James, we're gonna go ahead and get started, okay? All right. So it's gonna be a little cold, okay? I'm gonna start cleaning the labia. All right, one side, other side, down the middle. Get rid of that. All right, Mrs. James, we're gonna go ahead and get started. Just take a deep breath in for me, and on the count of 3, take a deep breath out, okay? Ready? 1, 2, 3. Deep breath out, deep breath out. All right, I see urine, so I'm gonna go ahead and advance it 1 or 2 more inches. And I'm gonna go ahead and inflate the balloon. Go ahead and discard that. All right, then I'm gonna make sure it's in place by pulling it back. It is. All right. I'm gonna go ahead and put this down. Okay. And I'm gonna grab the port now because we're gonna grab a sample. So I'm gonna clean the port for 10 to 15 seconds. All right. And let it dry for 10 to 15 seconds. All right. Now we got our 10 milliliters of urine. Now we can put this down. So take off our gloves. Do 20 seconds of hand hygiene. How are you doing, Mrs. James? Did you feel any pain with that? Any discomfort? No? All right, wonderful. All right, so we're gonna go ahead and get the stat lock ready. So I'd rip this open, prep the upper thigh, start of that, grab our stat lock, and clip it. Put it in. There we go. Go ahead and rotate it. And we're going to connect it to the upper thigh. Alright, there you go. Now we're going to go ahead and take the bag out. Making sure it's all undone, making sure it's not obstructed. And then I'm going to connect it to the side of the bed below the bladder. And then clipping any extra tubing to the bedding. Alright, now I'm going to just go ahead and get this out of your hair. Okay. Now I'm just going to straighten your legs. And I'm going to put the bed up, or the blanket up. Alright. I'm going to take off my gloves. 20 seconds of hand hygiene. Now we're going to collect the urine sample. For about 10 milliliters of urine. Cap it. So then I would write down the patient's name, patient's medical record number, and the date and time of the procedure, and then I would send this to the lab. Alright, Mrs. James, I'm going to be your nurse today, so 1 second, hand hygiene. If you need anything, please ring your call bell. If you feel any pain or anything, side rails up, bed in lowest position. Going to do one last scan of the room, make sure the tubing is okay, the bag's in place. And then I would go ahead and clean up my area. And then I would go ahead and document the date and time of the procedure. I would also document the patient tolerance of the procedure, the size of the catheter used, which was a 16 franc. I would document that the urine was yellow, clear, and had no sediment. And I would also document that the volume of the urine was 350 milliliters. So yeah, thank you, Mrs. James. I'll see you later. And I would dispose of this in the right receptacle. Hello, Mrs. James. It's Fernando, your nurse. How are you doing? Good. That's good to hear. Can I just confirm your name and date of birth? LeBron James, December 30th, 1984. Wonderful. And are you allergic to anything I should know about? No? All right. Good to hear. So, how's the catheter treating you? Do you feel any pain or discomfort? No? Wonderful. And does it feel like it's working? Like it's getting all the urine out of your bladder? Yes? Wonderful. So I'm actually here because I'm going to take out the Foley catheter. So let me explain what I'm going to do. So do you remember that small balloon at the tip of the catheter? I'm actually going to remove about 10 milliliters of saline. That's going to deflate the balloon. Once the balloon's deflated, I'm going to ask you to take a deep breath in, take a deep breath out, and upon exhalation, I'm going to pull the catheter out slowly, okay? And yeah, it shouldn't be a painful procedure. Might feel a little awkward or uncomfortable, but if you feel any pain, please let me know, okay? All right, do you have any questions or concerns for me? No? All right. And do you understand the procedure? Thumb up? Yes? Okay, thank you. Okay, so I'm just going to get everything ready, all right? So just sit tight for me. I'm going to close the patient's curtains for privacy. I'm going to do 20 seconds of hand hygiene. I'm going to place the patient in prone position. All right. Okay, there's a Chuck's pad between the patient's legs. Is it okay if I lift up the gown? Yes? Catheter looks good. And I'm going to move your legs in a frog-like position, okay? Any pain there? Any pain there? No? All right, wonderful. All right, so just sit tight for me, okay? So 20 seconds, hand hygiene. Pair of gloves. All right. All right, Mrs. James. Open this. And I'm gonna open this. Mrs. James. I'm gonna start deflating the balloon. Alright. Just going to make sure to pour all that out. And I'm just gonna double check I got everything. Yeah, I don't see any more saline, so I'm gonna go ahead and take that out. Okay, Mrs. James, I want you to take a deep breath, and on the count of 3, take a deep breath out, okay? Ready? 1, 2, 3, deep breath out, deep breath out. Great job. Alright, I'm just gonna go ahead, wrap this up. Right. And then I'm gonna put your legs back. So how was that? Any pain with that? No? Good to hear. I'm just gonna put this back down. Okay, sorry, a little sting, soft. Dispose of this. Alright. Okay. I'll be right back, Mrs. James. Just gonna go to the bathroom. So I'm gonna go to the bathroom and I'm gonna pour the urine in a graduated cylinder. And I measured about 800 milliliters of urine. The urine was clear, yellow, and had no sediment. And then I would dispose of the catheter in the catheter bag in the right receptacle. I'm gonna go ahead and dispose of this. Do 20 seconds of hand hygiene. So how is that, Mrs. James? Pain-free? Yes? Alright, so it's very important for the next 1 to 2 voids that we measure your urine. The reason for this is that it ensures adequate bladder emptying. And then for your first void, you might feel a stinging or burning sensation. But as you continue to void, that sensation should go away, okay? If you do feel an increased pain or bleeding while urinating, please let me know, okay? Alright. Do you have any questions or concerns for me? No? Alright. And then here's your call bell, side rails up, bed in lowest position. Alright, I'm gonna go ahead and document now. Thank you, Mrs. James. And then do 20 seconds hand hygiene. And then I would go ahead and document the date and time of the procedure. I would document that the patient tolerated the procedure well. I would document that the urine was yellow, clear, and had no sediment. And there was 800 milliliters of urine. And I would also make sure to measure the next 1 to 2 voids. And that's it, thank you. And then I would clean up the rest of my mess.